like to welcome everybody to this webinar. My name's John Wilding, based at the University of Liverpool in the UK, and I'm also President-elect of the World Obesity Federation. And this is the fourth of our seminar series on COVID-19 and obesity. And what we're going to focus on today are emerging insights into the relationship between COVID-19 and obesity, and think a little bit about the policy implications for countries who are dealing with this epidemic. What I'd just like to say before we start is a few housekeeping points. We're not going to allow live questions in the sense of people speaking, but you can ask questions. You can either make comments using the Q&A function or ask questions using the Q&A function, and we will give you the opportunity to ask questions and try and deal with questions immediately after each speaker. We will be recording this, and the webinar will be live on the World Obesity website so that you can go back to it if you wish to, and the slides will also be made available, and they'll all be circulated after the webinar. We'll also be collecting some feedback forms which will be circulated to everybody who has registered for the meeting. We've got a really exciting agenda. I'm going to just run into with a very brief introduction just to remind us about the relationships between obesity and COVID-19, but we're going to hear a lot more detail from Jimena Ramos-Salas from Obesity Canada, but currently based in Sweden. We're going to hear about the World Health Organization response and its relation to nutrition and non-communicable diseases from Francesco Branca from the WHO. We're going to hear some really interesting national case studies about how this has shaped policy from Karine Clement from Paris in France, and from Ricardo Luna from Monterrey in Mexico. We've allowed plenty of time for discussion at the end, and I think that will be interesting, and obviously we will try and answer any questions you have during the course of that discussion. So if I can now move on, here's the speakers. You can see what we all look like, and I think I've introduced everybody already. So we have myself, Jimena, Francesco, Karine Clement, and Ricardo Luna. So I'm going to talk about integrating obesity into global NCD and COVID-19 responses and give you a little bit of an introduction. Have the next slide, please. So just to remind us where we are now with this global pandemic of COVID-19, at the latest count, we are well over 5.5 million, approaching 6 million documented infections worldwide, with more than 350,000 people having died as a result of this viral disease. I don't think there is a single country in the world that has not been affected, although different countries are clearly being affected in different ways and at different rates. One thing that's become quite clear is that obesity doesn't seem to be a risk factor for infection with the virus, but it does seem to be a very important risk factor for the severity of the disease, the COVID-19 disease caused by the virus, and particularly people with obesity are more likely to require intensive care treatment, and they seem to be more likely to die of the disease. And we can see this really quite clearly in the next slide, which is a study published just a few days ago from the United Kingdom that compared people with obesity, people who'd had COVID-19 disease with the primary care population in the UK. And you can see here that by far the biggest relationship with mortality is age, with, if we take an age group of 50 to 59 as the reference range, as age increases, the mortality increases really quite quickly, and younger people are much less likely to die from the disease. Men are also more at risk, but perhaps the next and most important focus here is to show the relationship with obesity, and that as obesity class increases, the risk of mortality from COVID-19 increases, so that it's more than doubled in people with a body mass index over 40. And that is independent of the comorbidities that are caused by obesity, such as type 2 diabetes and chronic cardiac disease, which are also independent risk factors for COVID-19 mortality. We're going to hear a lot more about this relationship in the next talk, but what I'd also just like to do in the next slide is just highlight some of the potential mechanisms. This very nice review from Naveed Sattar, published in Circulation a couple of weeks ago, highlights the fact that people with obesity, of course, are more likely to be of lower socioeconomic status. They may have a poorer diet, and there may be factors related to the physical activity and race and ethnicity that lead to the problem of obesity and excess ectopic fat. This is direct mechanical effects on the lungs. It also has metabolic effects such as cardiorenal stress, hypertension, increased thromboembolic states, and of course diabetes, which ultimately lead to lower cardiorespiratory metabolic reserve, an impaired metabolic response. These individuals may also have some evidence of immune hyperreactivity, and all of these things result in a likelihood of them having a more severe response to COVID-19 infection, more likely to develop cardiorespiratory failure as a result of the disease. So this is biologically very complex and clearly very important, and something that we are still learning a lot about. So let's move on and think a little bit about the adverse effects of our response to the pandemic for people with obesity. So we've learned that the disease makes obesity is a risk factor of the disease, but what about the response? We're all experiencing lockdowns in one way or another in all of our countries. And people with obesity are already often feeling isolated and stigmatized, and this may become worse as a result of the response. They also are likely to have to even further curtail physical activity, which we know is a protective factor against obesity. And they may be in situations, particularly those people who don't have easy access to outside spaces, to comfort eating and snacking. And there is perhaps an emerging problem of COVID-related weight gain, not due to the disease, but due to the isolation caused by being confined to the home. There are also economic effects, and again, this may disproportionately affect people with obesity who are of low socioeconomic status, such as loss of income, food poverty, which may result in a reduction in the quality of the diet, and snacking, as I've already mentioned. There is also the problem that many healthcare systems are struggling to deal with the COVID-19 epidemic, the disease itself, and this has resulted in a reduced access to other forms of healthcare, and obesity treatments are no exception to this. In my country, all of our obesity clinics have effectively been shut down, and we are, and also other investigations and treatments, for example, to cancer, the availability has been significantly reduced, and these could disproportionately affect people with obesity. Next slide. So how should we embed thinking about obesity into the pandemic response? If we think about diet, we need to ensure adequate nutrition for all, focus on the most vulnerable, and try and reduce reliance on highly processed foods. If when we're thinking about our lockdowns and how we relax them, certainly being outdoors is better than being indoors because of less virus transmission. And there are opportunities here as public transport may have to be socially distanced and therefore capacity reduced, to actually promote walking and cycling as new ways of moving around our cities and towns. And Finally, about prevention and treatment, public health messages about obesity and COVID-19 severity is important, and we do need to provide access to accurate and reliable advice. We should be able to still provide at least remote support to people with obesity, and I think it's going to be a priority to start treatment services as soon as possible. What's WOF doing about this? Certainly we are working in many areas of advocacy. We're working with the WHO and including at the World Health Assembly last week. As we're demonstrating today, we are convening webinars and topic-specific engagement to try and keep the response and people active and interested in this. We had this very interesting response that came when we asked what was important in relation to COVID-19. And you can see here that food and obesity, as well as other factors, really came out very high in people's priorities. We're going to continue to educate people and build capacity, especially through the SCOPE program, as well as these webinars. And we are continuing to gather evidence and provide data through the Global Obesity Observatory and Global Obesity Economics think tank. And finally, I think this does fit in very well with the Roots response to obesity. The Roots Declaration, which of course was made and announced on World Obesity Day way back on the 4th of March this year, that had 16 organizations that were involved in setting it up and has had 550 individuals or organizations sign up in the first 4 days since the World Obesity Day. And you can see here what the Roots Declaration is about. It's about recognizing obesity as a chronic disease, about the importance of monitoring surveillance, about the importance of both prevention and treatment, and the fact that we should be using systems-based approaches to support people with obesity. I'm going to stop here, and I'm now going to hand over to Jimena, who's going to talk to us in a little bit more detail about the latest data around COVID-19 and obesity. Thank you, and I'll hand over to Jimena now.
Thank you very much for that introduction, Professor Wilding. I'm going to give a brief overview of some of the emerging data on obesity and COVID-19, which, as Professor Wilding said in his introduction, indicates that people with obesity are more likely to develop severe COVID-19 disease. I will end this brief overview with a call to action and outline some of the potential policy implications. Next slide, please. On this slide, I have summarized the key points that I want us to keep in mind. I would first like to clarify that in this presentation, I am using the medical definition of obesity, which states that obesity is a chronic disease characterized by abnormal or excess adiposity, which impairs health. There are a number of studies right now indicating that obesity may be a risk factor for developing severe COVID-19 complications, requiring critical care. And more recent studies also indicate that obesity, along with other chronic diseases, may be associated with increased mortality. Now, these studies have used an obesity definition that is based on the body mass index. And since there is now a broad consensus in the obesity community that BMI is not a good tool to diagnose obesity at the individual level, even though it may be a useful tool for population-based surveillance, to understand the mechanism that positions obesity as a risk factor for more severe COVID-19 illness, we need to use a clinical definition of obesity using clinical parameters like Professor Wilding was mentioning. And from a public health perspective, we should also consider the social parameters, such as the social determinants of health, quality of care, timely access to care, weight bias, and obesity stigma. Next slide, please. So I'm going to show you two recent studies that have been published making the link between obesity and COVID-19 illness. In this large prospective cohort study with over 20,000 patients from the UK, researchers studied the factors that were associated with critical care admission and mortality in hospital, as well as palliative discharge, A key point to note here is that the researchers in this study pointed out that the prevalence of obesity in this study population was 11%, which is lower than the overall UK obesity prevalence. The authors point out that this could be due to misclassification, underreporting, and the fact that the study population included a large proportion of elderly patients. This is something that we need to keep in mind for future studies. We need better reporting so that we can conduct these studies. Next slide, please. As you can see from this slide provided by the lead researchers of the study and available on the BMJ website, in this UK study population, age, gender, obesity, and underlying illness emerged as risk factors for severe COVID-19 illness. Now, when it comes to the underlying illness, the study found that obesity, chronic kidney disease, and liver disease were associated with increased hospital mortality. Now, in the discussion, the authors of the study note that the pattern of disease in the study population reflected the pattern reported globally in other studies. And the key issue that they discuss in this paper is that the fact that the mortality rate of patients who receive intensive mechanical ventilation care was higher than the mortality rate during the 2009 H1N1 pandemic. Next slide, please. In this study, with a much smaller population from New York City in the United States, researchers investigated the rate of hospital death in patients with confirmed COVID-19 and who were critically ill with acute respiratory failure. As you can see in this study population, the median age was 62 years, and more than half of the patients were men. 82% of patients had at least one chronic illness, and the most common ones being hypertension and diabetes, both of which we know are also associated with obesity. In this study population, 46% of the patients had obesity, which is higher than the overall prevalence of obesity in New York City. In this study, however, researchers looked at clinical biomarkers for inflammation and thrombosis and found that these were independently associated with in-hospital mortality. Severe obesity, however, was not associated with an independent risk factor. What this study highlights is the need for us to ensure that future studies use clinical parameters to understand how obesity could be linked to COVID-19 illness. It is not enough to have BMI in these studies. I would also like to point out that in this study, it indicates that there was a high incidence of critical illness among racial and ethnic minorities. Also, in both of these studies, men were overrepresented, which means that there are gender differences as well. This means to me that we need to also consider the social determinants of health in these studies. Next slide, please. I will now end this brief overview with a call to action and outline some of the potential policy implications. This week, Obesity Canada and its partners, including the World Obesity Federation, released a call to action on weight bias, obesity stigma, and COVID. Although there are a few studies exploring how weight bias and obesity stigma is impacting the COVID-19 pandemic, we have decades of research indicating that people with obesity experience pervasive weight bias and obesity stigma in the healthcare setting, as well as in their daily lives. Next slide, please. There is a need for more research to understand the impact of social determinants of health, obesity, weight bias, and obesity stigma on COVID-19 testing, treatment, and care. However, since obesity is not recognized as a chronic disease in many countries, many clinics, hospitals, and public health departments are not collecting data about obesity during the COVID-19 pandemic. And if we want to understand the link between obesity and COVID-19 illness and mortality, we need clinical data that goes beyond BMI. We need to operationalize a clinical definition for obesity, and this could be done by getting lab tests that measure inflammatory and metabolic factors, for example. Furthermore, from the field of weight bias and obesity stigma research, we know that people with obesity may avoid getting to the hospital or clinics for fear of being blamed and shamed for their weight. Future studies could explore how weight bias and obesity stigma impacts access and quality of care during the COVID-19 pandemic. These studies are starting to emerge. A recent study published in Obesity by Sutton and colleagues indicates that people who have experienced weight stigma are less likely to trust in people and institutions to manage the COVID-19 outbreak. This may have implications for future public health interventions to mitigate this pandemic. Also, as scientists are looking for coronavirus treatments, how are they including the needs of high-risk groups, including people living with obesity? How will policymakers prioritize high-risk groups when treatment becomes available? Finally, we need to investigate how high-risk groups are being supported during this pandemic, as Professor Wilding mentioned. How are healthcare systems going to maintain treatments services for chronic diseases such as obesity during the pandemic? And from a policy perspective, policymakers should be considering how future COVID-19 responses can reflect the evidence about obesity as a potential risk factor for COVID-19 complications, critical illness, hospitalization, and mortality. And based on current studies, pandemic policy interventions need to consider the intersection between social determinants of health, vulnerability to infectious diseases by people living with chronic diseases, such as obesity, and how stigma may impact access and quality of testing, care, and treatment. These studies also highlight the importance of forward planning and preparedness studies for future waves of coronavirus. And I look forward to discussing this more in the discussion section of the program. Thank you very much.
Thank you very much, Ximena. That was really very useful indeed. I don't see that we have any questions at the moment. I would remind people that you can use the Q&A function in Zoom to ask questions if you have any questions. I'm going to just allow us to move on now because we've got plenty of time for discussion at the end. And I'm going to now very pleased to introduce Francesca Branca, who's the Director of Nutrition and Food Safety at the WHO based in Geneva, Switzerland, who's going to talk to us about how the WHO is coordinating its response to COVID-19 along with trying to deal with this problem of nutrition and other non-communicable diseases. So it's great to hand over to you, Francesco.
Thank you very much, Professor Wilding, and congratulations to the World Obesity Federation for convening this seminar. Indeed, this is something that we need to look at the response, specific response to obesity in the context of our overall response to the COVID epidemic. And if I can have my next slide. This is basically what WHO does in response to COVID-19. It's all written in our strategy update, it's coordination, monitoring, country preparedness and response, the epidemiological analysis. We help countries to get their supplies. We support the implementation of the response at country level. And we try to coordinate and accelerate research, innovation, and knowledge sharing. At the moment, we have been able to mobilize about 38% of the response needs. So you can see there's still a gap there, but the world is still unable to end the epidemic, so we'll have to live with it for still a number of months ahead of us. On the response to non-communicable diseases, we've also been able to collect information that indicates that a lot of service disruption has taken place. And probably, particularly in countries with low and middle income, one country in two has had some disruption of services for the management of non-communicable diseases because of the lockdown, because of the prioritization given to the COVID response in health services, because of a shortage of supplies. So non-communicable disease has been somehow neglected in this situation, and clearly patients with obesity and comorbidities have suffered from it. Next slide, please. So specifically on obesity prevention and management, what WHO has done is to, first of all, clarify guidance. There's been really questions across the board to try and understand what should be done differently. There have been magic bullets suggested, completely lacking evidence. So WHO has put up guidance on a number of relevant areas: nutrition advice for adults, physical activity during quarantine, very important guidance around early child nutrition, and particularly breastfeeding advice. Some countries are advising the separation of mothers with COVID from their children, and the use of infant formula is picked up in those countries. WHO is insisting that this shouldn't happen, and that with adequate respiratory and personal hygiene, breastfeeding should continue. There's been also guidance on the continuity of services, and particularly essential maternal, newborn, and child health services, which certainly will have an impact on different forms of malnutrition. Next slide, please. Of course, an important element has been speaking directly to the public. So WHO has designed several communication campaigns, and I'm just mentioning here the ones that are relevant to our discussion today. There's been a Healthy at Home campaign, and these are the sections that are related to healthy diet and physical activity. Next slide, please. A strong effort in communicating through social media and focusing on the concern that emerged during the lockdown, and particularly fighting back on the use of sugar-sweetened beverages and promoting instead the use of water, and also avoiding alcohol consumption or keeping it to the minimum. And giving some practical suggestions on how to implement physical activity even during the lockdown. And we even had a virtual edition of the Walk the Talk, the traditional Walk the Talk event that we have now at the World Health Assembly was this year was done virtually. Next one, please. An important, of course, player here was our Director General. He's in the middle of this huge storm, but he did find the opportunity to speak during his briefing. He has several briefings to the media and to the member states, and he did speak about prevention of obesity. He did speak about healthy nutrition, diets, about exercise, about alcohol consumption. Next slide, please. At the WHO, and David was mentioning the fact that World Obesity was there. We do appreciate your presence and your voice, because indeed obesity wasn't mentioned in the resolution. But the important thing is that there was a resolution, and this resolution was also about the importance to support the continuity of health services, and it did mention the importance of non-communicable diseases and improved nutrition for women and children. So it was a virtual assembly, but extremely well attended, with several heads of state and prime minister participating. These messages have been heard very loudly, and the attention to non-communicable diseases is really there. Next slide, please. Yesterday, we launched a WHO manifesto for a healthy and green COVID-19 recovery, really with the message that we need to look ahead of us and we need to build back better. And you see, these are the 6 points that have been mentioned. This is something that we acknowledge come particularly from the environmental movement, but the focus on healthy and sustainable food system to give people access to healthy and affordable food is notable. And next one, my last slide, is really to say, well, today we spoke about the response to COVID, but I would like to say that this is part of the discussion we're having with the World Obesity Federation about how to scale up the WHO's work on obesity. And certainly a big piece of work for us is the guidance. So the update of the completion of the guidelines on healthy diets. I think we'll have a bunch of them published at the end of this year, particularly the ones on fat. We're now moving into a new era of providing guidelines on policy, and particularly in the area of food environment, labeling, marketing, fiscal policies. And we are this year going to have new guidelines on complementary feeding, which will look at the prevention of obesity and non-communicable diseases, in addition to the traditional attention to undernutrition. An important piece of work where we hope that we can collaborate with you is the development of recommendation on the management of overweight and obesity in children and adolescents. But of course, what we want to see is action. So we'll have to work together on the implementation of the recommendation on the Ending Childhood Obesity Commission. And particularly, we have seen that a good way is to engage member states through the establishment of action network, engagement with partners. So we have more programs with other UN agents, and particularly we welcome the interest of UNICEF on, for example, a policy area such as marketing food to children. And then finally, the data, the need to have more data, particularly in the childhood period, the data on the school-age children, and we're having in mind the global expansion of a successful childhood obesity surveillance initiative that was so popular in Europe. So indeed, we look forward to working with you all, and the call to action that Canada, Obesity Canada developed is something we will very carefully look at. Thank you.
Great, thanks very much, Francesco. I wonder, we have had a couple of questions come in, and I wonder, and they seem very relevant, perhaps you to consider them, and we can always have a bit more detailed discussion in the discussion later. But there's two related questions I've seen around, whether obesity is increasing during the lockdown and whether that might be related to high use of processed foods, and whether we feel that the food companies are maybe taking advantage and promoting the sort of unhealthy foods, and what can we do in policy terms to deal with that. I don't know whether you want to try and respond to that or have a think about it, and we can discuss it a bit later on.
So this is Jimena speaking. I'm not aware of any studies right now that are actually measuring the prevalence of obesity before and after the pandemic. And I think we do need that type of surveillance. But there's no doubt in my mind that the significant stress that people are going through right now in this pandemic may contribute to those unhealthy coping strategies, as well as physiological aspects that stress causes to increase fat storage, and that may actually increase the risk for obesity in the long term. So that's just my speculation based on existing research about the impact of stress and on behaviors and fat storage. But I'll welcome somebody else to comment on that.
If I can come in, Francesco, here, we've also received some episodic reports about a number of surveys that have been conducted. There's one, for example, that in the context of a European collaboration on a STOP project. There is reports about, of course, imbalances in diet and physical activity, sometimes even documented increase in weight, but, A, it's not systematic. B, it's perhaps too early to say. On the issue of the companies, we definitely have documentation of infant formula companies having taken advantage of the lockdown to promote infant formula, unfortunately. On the comfort foods, we've seen more on the alcohol than on other foods or drinks. And on the question that comes from Marie about the recommendation of the management of overweight and obesity, we're just in the process of establishing the guideline group, and we would like to reach out to a broad set of constituencies. So yes, indeed, we'll hear from you also for the formulation of the right questions. Over.
Brilliant. Thank you very much indeed. I think probably we should move on now, but we will come back to some of these discussion points. We have got lots of questions coming in now, which is fantastic. But I think we should hear a little bit about the individual country responses. And we're going to hear first from France, from Karine Clément, who's going to talk to us about what's happening in France in relation to obesity and COVID-19. Karine, over to you.
Thanks a lot, John. So, hi everyone. So, so the question is to take this opportunity to discuss whether this current experience we are living with the COVID-19 pandemic could be a lever to advance the cause of people with obesity. And I will take indeed the this French example. So then with the next slide, to try to address this question, I guess it's important to explain what is the situation in France, and especially regarding the network organization we have, both for obesity care management as well as clinical research. And basically we have several pillars. So what is this French clinical research network on obesity, which was created in 2014 based on a governmental program called Investment for the Future. And this network is very important in centralizing France's clinical research efforts in the field of obesity. Second, and then you see on from the map actually, we have the creation of 47 specialized obesity centers. And their role is really important in harmonizing and coordinating obesity management, and especially in developing integrated care pathway for the management of persons with obesity, both including medical and surgical approaches. And these centers were created both on the initial obesity plan, which started in 2010. And what is quite interesting to mention is that basically before the pandemic, the government launched a new obesity roadmap, and this was in October 2019. And a third also important pillar is the French Association for the Study of Obesity, which is called AFERO. So at the beginning of the pandemic, we created an alliance for obesity-19 crisis. And as early as April 3, we sent an alert to the Ministry of Health. Next slide. So what was the warning based on? So at that time, I have to say that we had also a few information. Of course, those information coming from the literature survey and knowledge we had from other virus, and especially the H1N1 pandemic. We had only feedback from intensive care units in several countries, especially in France as well as in UK. And in UK, we had feedbacks mentioning that actually more than 40% of patients with obesity were actually in ICUs. And then a few days later, there was this first French publication performed in Lille University Hospital, mentioning that indeed severe obesity increasing the risk of invasive mechanical ventilation in intensive care, regardless of age, sex, and diabetes. And of course, some of this information were basically taken in and mentioned in a French article from Le Monde, which is our well-known newspaper. And I have to say that at that time, we only get this information from the High Council of Public Health, mentioning that only a BMI over 40 define a threshold for risk to have a severe COVID-19. Next slide. So what was the nature of the warning to health authorities made by our alliance between FORCE, CSO and AFERO? So it was all about, of course, the need for information to persons with obesity, avoiding a panic situation, and mentioning preventive measures. But we also insisted on the fact that we absolutely need to organize a follow-up during the lockdown with a multidisciplinary approach, basically combining action for doctors, dietitians, psychologists if needed, as well as experts in exercise. And we mentioned that this could be done and should be done by telemedicine. And also we ask for the authorization that GPs could actually prescribe work stoppage if necessary. Then we asked other things regarding especially the facilitation to virus screening access. And we again take this opportunity to mention the important situation of health inequality in the field of obesity, as well as the risk to have stigmatization. And that communication, for example, should try to limit the potential double stigma of obesity plus COVID-19. And finally, there are also issues in person being infected, of course, with COVID-19. And we mentioned the needs for good practices in acute and medium term. So what do we get? What was the answers? So first of all, in a few days, there was a change of the mention of regarding COVID-19 done by the High Council of Public Health. So basically, they rapidly recognized that indeed obesity per se, with BMI over 30, is now recognized as a risk of severe form of COVID-19. Next, if you can just scroll down the few lines. And then public authorities perform basically recommendation and wrote a care sheet for people in a situation of obesity during the COVID-19 pandemic. Next, and it was, if you can do another scroll down on the slide, and it was done basically based on the recommendation written by the Alliance, FORCE, CSO, and AFERO. On the multidisciplinary aspect and care aspect, it's important also to mention that we had actually a national hotline with psychologists, but there were not necessary experts in obesity care. And for now, we're still waiting answers regarding dietitian and multidisciplinary follow-up, because as you could imagine, of course, there are issues with cost reimbursement. And during this period, there has been many documents produced for patient guidelines for practitioners and newsletter from the Alliance. And finally, the role of patient association was also very important, especially for media dissemination. The next slide. So what is the current situation here? So on the scientific side, and this was mentioned in the previous presentation, I think we got new publication based on the French different centers, and especially confirming to some extent that indeed, if you compare severe COVID-19 illness, there is non-critical illness, it's higher in patients with obesity compared to those actually who don't have obesity. And then there is this recent diabetes survey called Coronado, showing and confirming that indeed in type 2 diabetes population, BMI is a major risk factor and not necessarily glycated hemoglobin or treatment. And this is in links with other international reports. So then we have a challenge here, and especially on the policy side. So the challenge is, if I can say this like that, is not to watch the souffle fall, but to build on authorities' awareness. Indeed, actually, the pandemics really highlights the importance of multidisciplinary care for patients with obesity and the need to support the associated medical and paramedical costs. And there are opportunities to develop therapeutic education program in ambulatory care facilities and using telemedicine. And this is exactly what the obesity roadmap, our French obesity roadmap, is about. So the future will tell us whether this condition, this crisis, will be important to make progress on the obesity side. And of course, and this is absolutely key for now, is that we need a concrete action for research. And what we don't know if this crisis will be helpful by pointing to the importance of promoting research effort, or and this is a possibility, can it worsen also the situation because funding could be oriented or dedicated to other disease rather than chronic disease. So I think time will tell us. Thanks a lot.
Great, thank you very much, Corinne. I think we should just move on then to hear from Mexico, and then we'll come back to questions and answers. So Ricardo Luna, who's president of the Mexican Society of Obesity, is going to talk to us about the experience in Mexico. Over to you, Ricardo.
Thank you. I will talk about first what Mexico's situation was before COVID-19. This slide, please. It's important to mention that Mexico has a population with high rates of chronic diseases due to lack of physical activity, along with amount of consumption of industrialized food with a low nutritional value and high caloric value. According to the last National Health and Nutrition Service, the percentage of adults with overweight or obesity is 75.2%. Mexico is ranked as one of the first countries with obesity in the world. The obesity epidemic that our country has been suffering in the last 40 years has driven to other chronic diseases such as diabetes, hypertension, chronic obstructive pulmonary diseases, kidney diseases, sleep apnea, among others. And this has resulted in around 300,000 deaths per year, independently from the pandemic COVID-19. A lot of these comorbidities that are related to obesity are presented in a young people, because half of the population is under 27 years old. And this is the situation Mexico faced the COVID-19 pandemic from the beginning. Next slide, please. One of the strategies to get information about the comorbidities that could have implication in the cause of the death between obesity and COVID-19 in Mexican population is the training of the healthcare professional in the correct filling out of the death certificates. These death certificates must indicate comorbidities or previous conditions that may have contributed to death, such as obesity and other diseases necessary for their accurate analysis. With this information, the Mexican government shows every day in a press conference a graph indicating that obesity is among the first 3 causes of mortality, and claim not only the elderly is a risk factor group, but also people who live with obesity. Next slide, please. Next slide. How Mexico identified obesity as a risk factor for COVID-19 early on? Well, at the beginning of the COVID-19 pandemic, Mexico didn't have enough evidence to define risk group of population. Initial studies from other countries suggested that COVID-19 is more likely to infect older male adults with chronic diseases. As a result, they weaken immune function, turning out into fatal events. With the information we had available, Mexico assumed obesity as a risk factor based on evidence related to influenza virus, and published on February 14 guidelines where obesity is suggested a major risk factor for COVID-19 complications. 14 days later, on February 28, the government of Mexico declared the first positive case of COVID-19. Next slide, please. When the infection started to spread through Mexico, young adults began to experience complications which were correlated with obesity, diabetes, and cardiovascular diseases. Mexico has a large young population with obesity. It could have thought this was a positive aspect regarding to the COVID-19, but we have a population with chronic health deterioration, with a significant magnitude of obesity and these comorbidities. This made Mexico to react early on, and this is the reason why Mexico established obesity as a risk factor, regardless of age, because of these health campaigns are not only aimed to the elderly, but also aimed to people who live with obesity. Thank you.
Thank you very much indeed. So I think it's really interesting to see how different countries with different demographics are dealing with this in different ways. And I think that was a very helpful summary for what's happening in Mexico, where you have a much younger population than some of the other countries that we've talked about, and where that effect of obesity may actually be disproportionately affecting young people. I'd like to now open this up for discussion. There has been a few questions, and I'm going to try and break these down into sections so that I'm trying to deal with the issues that have been raised by the questions. I may not give the exact question that's been given, but what I want to try and do is discuss some of the key issues. So I'm going to start with questions that probably would be best answered by Jimena, but clearly others may want to chip in, and very welcome to hear your comments on this. There've been a few questions about if we're going to use a different definition for obesity other than a BMI, which is clearly important, and also just thinking about the inflammatory aspects of this. Firstly, I guess, what definition do you think we should use? And thinking about the inflammation, how do we separate this very complex issue about the inflammatory response in obesity, which may enhance the adverse response to COVID in COVID illness, from the natural response to the virus? So that becomes quite complex, I think, when we're dealing with the immune system. So I guess the easiest question is, how would you redefine obesity? And then the hardest one is about the immune complexity. Do you want to comment on that?
Thanks. You think that's an easy question?
I don't think it's an easy question, really.
I think you could answer that better than me. But from a clinical perspective, Obesity Canada has always talked about the need to define obesity based on health impairments. So how does health get affected by the excess or abnormal adiposity? And there are you can do various lab tests, I guess, to see how adiposity is affecting a person's health, and that you could probably speak more about what those lab tests are. But I think from a stigma perspective, the key aspect of not identifying or diagnosing people with obesity based on solely a number of BMI is that it can cause stigma when we frame obesity as a number. And when people look at somebody who lives in a larger body, we automatically assume that that person may be unhealthy or making or doing unhealthy behaviors. So from that perspective, I really believe that obesity needs to be diagnosed by a healthcare professional, a qualified healthcare professional, and in collaboration with the patient to determine how their weight or the excess adiposity is impairing their health. But John, I would open it up to you to talk from a medical perspective of what are the tests that you could do at the clinical level to identify how weight or adiposity is affecting health.
Yeah, I mean, I think the way I would try and answer this is, firstly, I think we can use other simple anthropometric measures, even such as waist circumference, which are relatively simple to do, but not often recorded in medical records. And if we have that data in individuals before they develop COVID-19 infection, then clearly we can establish whether that is a risk factor. But when you look at the data that has been looked at, where people have compared it with data from primary care, which was what was done in the UK study that I briefly presented at the beginning, it still appears that even if we just use BMI, it does seem to come out as a risk factor for, at least for mortality. But having said that, I do think that we do need to be more sophisticated in this. And I think that's one thing that some of the prospective studies that are ongoing will help us with. And it may also relate to nutritional status as well, and physical fitness, and these all have to come into the equation.
Yeah, and I think it could also be, in Canada, we use the 4 M's of obesity management. So to assess whether obesity or excess weight impairs your metabolic health, your mental health, your mechanical health in terms of your bones and joints, and your social health, like monetary, your job, your income.
Yeah.
So there's a broad way of assessing obesity using those 4 M's. Not just in terms of body size, but the body size could be an issue, right? Because you were talking about, mechanistic aspects in terms of lung capacity or people being able to be placed on ventilators. What are the physical size aspects of a person's body that may contribute to poor COVID health outcomes?
Okay, that's great. I'm conscious of time. I just want to try and deal with a couple of the other questions that have come up, and I guess this next one is related. I'm going to try and answer it myself to move on, so that I can move on to the next question. And this relates to this complex relationship between ethnicity, socioeconomic status, and COVID-19 outcomes, and that it's clearly very complex. And I think at the moment we don't have a clear signal on this. There's no doubt in the UK and the US that people from Black and other ethnic minority communities seem to be disproportionately at risk of poor outcomes from COVID-19, whether that is a partly genetic factor or whether it's related to poor socioeconomic status and associated illnesses, including obesity, diabetes, is, I think, difficult to disentangle at the moment. But clearly that is something that we're all paying a lot of attention to. I don't know whether Jimena or Francesco want to comment briefly on that, because I have a couple of other questions that I'd like to ask other panelists before we move on.
Yeah, John, thank you for that question. It's an important question, and in fact, it's a major confounding in our analysis on non-communicable diseases. I don't think we have the answer at the moment, but clearly in terms of the, first of all, sensitivity to the disease, and then in terms of the access to health services, we see enormous inequalities. And I think that's something that we need to consider in our responses.
Yeah. Thank you. I don't know whether Karine or Ricardo, whether there are any data from France or Mexico that could help us with these questions.
Just a little comment. No, I think we don't have really information regarding ethnicity and so on. The point I want to mention is that it was already very difficult sometimes to have, BMI, I mean, body weight, and in patients being hospitalized or at the, intensive care units. So, but of course, I fully agree with, all these needs for patients, for stratification, better definition, and so on. But in this complex crisis, it has been sometimes difficult to get information regarding weight per se. So, yeah.
Yeah, I think we all recognize the difficulty there. I'm conscious of time, and I think we probably do have to close. There has been some very interesting discussion. I think we could probably discuss this for many more hours. But I think what I have to do is sum up now. I think it's very clear from the evidence that we have that obesity is certainly a risk factor for severe COVID-19 infection, and that the effects of the response to the pandemic in some ways may have made that worse. I think it may also, it's clearly very important that when we look at this, we need to consider issues such as ethnicity and socioeconomic status, which seem to be very important drivers of disease. And when we're thinking about the response to this disease at an international level as well as at a local level, we need to think about how we can make sure that people can maintain healthy nutrition and a healthy amount of exercise as we come out of these lockdowns, so that we don't make people more at risk of the disease should either another pandemic come along or if we have a second wave of infections. I think I should just now thank my co-speakers, Jimena from Canada, Francesca Branca from WHO in Switzerland, Karine Clement from Paris in France, and Ricardo Luna from Mexico, for providing some really interesting insights into COVID-19 and obesity. And thank the organizers at World Obesity. There's a lot of people working behind the scenes to make this work. We are collecting a lot of information about this, and we will be providing a lot more data online next week. You can look online and find much more resources, and I would encourage you, if you're interested, to get involved in the Scope e-learning around obesity, and particularly around obesity and COVID-19, and there's some important links there. So thanks very much, everybody. It's been really interesting to talk to you all, and I hope you found this interesting and useful. Goodbye.